So the fallopian tubes can become mildly or severely blocked due to mucus or scarring or adhesions. So blocked fallopian tubes are actually probably more prevalent than we think. They're actually responsible for 20% of cases of female infertility, and they severely increase your risk of ectopic pregnancy. And this is because the fallopian tube is blocked and prevents the fertilized egg from traveling to the uterus, and instead it implants in your fallopian tube and grows there. So why does this fallopian tube become blocked? And the reason for that is because the fallopian tubes are actually very, very tiny and narrow. So they're only 10 centimeters long or 4 inches in length. And they're the width of a regular strand of spaghetti. And inside this is a very narrow passage about the size of a sewing needle. And so the egg that's needing to travel through that tube is actually roughly the size of a full stop. So because the fallopian tube is so small is a reason that they can actually become blocked. Now, the fallopian tube is actually contains mucus, and this is because it actually slows down the passage of the egg, which gives the endometrium more time to thicken, so to sustain implantation in pregnancy, which is pretty clever. But the problem is any mucus-producing organ can become blocked. Just think of your nose. So, and this mucus can become thick for many reasons. This includes eating mucus-producing foods such as dairy, or particularly ingesting dehydrating substances such as pharmaceutical drugs or coffee or alcohol. And smoking infections can also be a cause of blocked fallopian tubes. Other more serious reasons that the fallopian tubes might be blocked are traumatic vaginal birth or a C-section, endometriosis, and autoimmunity. So some of these causes can actually lead to scarring and adhesions, which can pull on and distort your fallopian tubes, and in which case they may need to be removed surgically with a laparoscopy. So to assess the health of the fallopian tubes, the procedures include having a hycosi, which is a hysterosalpingo-contrast sonography, where fluid is injected through the cervix and ultrasound scan is used to see if the fallopian tubes are actually blocked. This procedure can actually be used to treat fallopian tubes if they are actually rinsed with saline solution. So in terms of natural treatment for blocked fallopian tubes, once the initial cause of the blocked fallopian tubes has been identified and addressed, it is actually medically applicable to treat naturally. And the natural fertility approach focuses on preventing recurrent infections and strengthens your immune system, and also minimizing scar tissue. And we do this through providing adequate nutrition, improving circulation to the area, massage, and also pelvic floor exercises. So nutritional and herbal therapies can be really beneficial in mild cases of scarring and blocked tubes, while actually some of the manual therapies, such as the massage, have actually been shown to help even quite severely blocked tubes. So if you have blocked fallopian tubes, the sorts of dietary recommendations we have for you are to avoid mucus-producing foods such as dairy and soy. You also want to avoid allergenic foods such as yeast, dairy, soy, wheat, eggs, and any other food or substance that you're allergic to, which may actually show up on your food intolerance chart. We want you to avoid coffee and alcohol. You want to drink 2 litres of purified or filtered water every day. You want to increase your intake of garlic because this actually naturally prevents bacterial infections. It's a good idea to increase cinnamon and ginger and cayenne in your diet because these all improve the blood flow to the uterus, and they will actually break up any of the congested mucus. And dietary-wise, a combination of spirulina and chlorella, or actually green tea, will assist your body to remove the toxins and also to repair the tissue. In terms of lifestyle recommendations, highly recommend you to stop smoking. Acupuncture is fantastic because it moves the energy around the body, it moves blood and mucus, and it helps the body to clear any blockages. You could get yourself an abdominal massage or use a self-massage video at home. Exercise is fantastic because it improves circulation and gets your limbs moving. Doing yoga is great. And of course, see a naturopath or herbalist to get some suggested herbs and supplements prescribed professionally. And also, I don't know if you've heard of castor oil packs, but they are fantastic at breaking up the scarring when done regularly. The sort of herbs and supplements we recommend are omega-3 fatty acids and zinc, selenium, vitamin E, magnesium and silica. They can actually reduce the inflammation and the scar tissue. They can remove the adhesions and keep the cilia in good shape. There are also herbs that might be helpful, so this will all depend on what your practitioner recommends for your individual situation.